My name is Dr. James Chen, and I have spent 18 years telling people they are dying. I have sat in chairs that are slightly too soft, in rooms that are slightly too warm, and I have looked into the faces of people who had been planning to attend their daughter's wedding next spring and told them they will not make it past August. I have done this hundreds of times. I have become skilled at it. I have the right tone. I have the right sadness. I have the right ability to hold space for someone's horror. I have perfected the art of compassionate delivery of devastating news, and I have absolutely hated every moment of it. I have hated it with a depth of feeling that I have never admitted to anyone, because admitting it would mean admitting that I am not equipped for this work. The irony is suffocating. I became a palliative care physician because I believed I was going to be the one to make death better. I was going to be different from the other physicians. I was going to see death not as a failure, but as a transition. I was going to eliminate suffering. I was going to help people transition with grace and dignity. I was going to be the bridge. What I discovered very quickly is that death does not care about your intentions. It does not care that you have studied the literature on a good death. It does not care that you have thought deeply about the meaning of suffering. Death is not philosophical. It is brutal. And suffering is not something that can be eliminated through good bedside manner and the right medications at the right doses. You manage it. You reduce it. You do not eliminate it. I have carried every death I have not been able to prevent. I have carried them in my body. I have carried them in the way I move and breathe. I became a physician to relieve suffering, and I have become, instead, a witness to suffering I cannot change. I had spent 18 years performing peace from behind glass. That is how I thought of it eventually. I had developed a professional presentation of calm that was entirely real in one sense. I was not faking the care. I did care deeply about reducing suffering, and entirely false in another sense, because I was performing it from behind a barrier I had constructed, a very sturdy barrier, to keep all of it at a survivable distance. I was protecting myself. I was also failing the people I was supposed to be with. I was not present. I was present professionally. I showed up. I said the right things. I made the right gestures, but I was not there. There is a difference between being present professionally and being actually present. The first is a performance. The second is a belonging. I had perfected the performance and abandoned the belonging. What made it worse was that I had been trained to call this boundary professional compassion. In medical school, in my residency, and every training I received, I learned that this distance was necessary and healthy, that the boundary protected the physician so that the physician could serve the patient better, that the separation was not cruelty but wisdom, that I was supposed to feel sadness but not feel the weight of that sadness in my own body. I had learned this lesson well. In March of 2022, I had emergency surgery for a pancreatic complication that my own gastroenterologist, a man I had known for 15 years and worked alongside dozens of times, described as one of the worst cases he had seen in 20 years of practice. He said this to me while I was terrified and waiting to go into surgery. He said it with a quality of concern that cut through my professional distance. He was not performing. He was genuinely concerned. I was in surgical ICU for 11 days following the emergency procedure. During the surgery, my heart stopped twice. The first time, they brought me back quickly. The second time it stopped, it stayed stopped for 9 minutes before my team brought me back. I have reviewed the operative report since. 9 minutes is long enough for permanent neurological damage. Brain cells begin to die. The tissue begins to degrade. 9 minutes is long enough to understand things that you cannot understand while you are still attached to a functioning brain. I want to tell you about the 9 minutes. I want to tell you what 9 minutes felt like from the inside of that experience. There was no pain. There was a complete absence of the particular kind of stress that a body in distress creates. There was a quality of warmth that I will describe as warmth for lack of a better word, though what I mean by it is not temperature in any physical sense. It was more like being inside something that was fundamentally favorable toward me, not indifferent, not neutral, not the kind of universe that is indifferent to human suffering, which is what I had believed for my entire career. Actively favorable. The way the feeling of being home is not about the architecture of the building, but about the quality of welcome that belongs to a specific place where you are known, where you have always been known. I had never felt this way in any actual home. I had been looking for it my whole life without knowing what I was looking for. All the years I had spent in professional distance, all the years I had spent behind glass, had been an attempt to find this feeling in a place where I would never find it. I had been searching in the wrong location. And now, without searching, without trying, I had found it. I was known there, completely. Not in the way that colleagues know you, through a resume and a reputation and a decade of interactions in conference rooms, where you show your best self and hide everything else. Known the way you are known by something that has had access to every moment of your life, every thought, every shameful thing you have never told anyone, every moment of cruelty or selfishness or cowardice you regret, and has found nothing there that altered its assessment of you, has found in fact only evidence of your worthiness. I had spent 18 years carrying the accumulated weight of the deaths I had accompanied and had not found sufficient clinical language for. 18 years of carrying weight that I was told I should carry, but was not supposed to let affect me. And in this place, that weight was simply not present. It was not that it had been taken from me. It was that it did not belong to me in the first place. In that place, this was obvious. The weight had never been mine to carry. I had picked it up out of a sense of obligation, out of a belief that this was what a good physician does. I had picked it up in the moment when I decided that I should not feel the things I was feeling, and I had carried it for 18 years. There was a table, not a metaphorical table, not a spiritual symbol of a table. An actual round table that had been in my grandmother's kitchen in Portland, the one she bought at a yard sale in 1971, and kept in her kitchen until she died in 2009. The table had a wood top that had been scratched and stained by years of living. I had eaten more meals at that table than I could count. I had done my homework there in the afternoons while my grandmother baked bread. I had told her about my dreams and my fears and the things that were happening in my life. I had been completely myself at that table in a way I had not been completely myself anywhere since. I could remember the exact quality of light that came through that kitchen in the afternoon, golden and slanting. The warmth of the wood beneath my forearms. The smell of bread and something cooking, usually something simple that my grandmother was making for dinner. The sense of time having stopped, or rather, of time being the right pace, unhurried and generous. Time moving at the speed of conversation, at the speed of being truly present with another person. My grandmother was at the table. She had been dead for 13 years. She was exactly herself, in the way that I cannot improve upon by describing it. She was just exactly herself. She looked exactly the way I remembered her. She looked exactly the way she had looked before the cancer took her. She was sitting in her usual chair, and she poured me tea from her teapot. The tea steamed. I could see the steam. The cup was warm in my hands. She sat down across from me, and she did not say anything for a while, because she had never been someone who rushed the beginning of a conversation. She was the kind of person who understood that some things took time to say. She was waiting for me to settle, and I was settling. The weight that I had been carrying for 18 years was not present here. What she communicated to me, eventually, was something I am still processing. She did not speak to me in words, but she showed me things. She showed me that the patients I had been telling were dying were not going nowhere, that the terminal confusion that I had charted as the brain shutting down was actually something else. The moments of clarity in the final hours, the moments where the dying would suddenly seem to see something that was not in the room, that was not a hallucination. I had been wrong about that. She showed me that the glass wall I had been standing behind for 18 years had been protecting me from something that was not actually dangerous, that what I had been protecting myself from was the experience of being fully human. The weight of accompanying the dying was not supposed to be carried behind glass. It was supposed to be carried the way you carry something for another person, picking it up, feeling its weight in your own body, understanding its reality, and then setting it down on the other side. Not setting it down on yourself, setting it down with the person you were accompanying. I had been refusing to pick it up. I had been sliding it along on this side of the glass while I watched them carry it alone. She also showed me my grandmother's kitchen in a way I had never seen it while I was in it. The warmth of that kitchen, the particular quality of being fed and unhurried, was the same quality as the place I was in. Not similar, the same. The warmth of a particular kitchen where someone loves you is not separate from whatever warmth holds the universe. It is the same warmth at a different scale. The universe is warm the way my grandmother's kitchen was warm. It is warm because it is fundamentally favorable. It is waiting for you to sit down. I came back into my body in the surgical ICU over the course of several hours, which was not the dramatic sudden return I might have expected, but a gradual reassembly, a piece at a time. Pain first. The pain was so real that it confirmed to me that I was real. I was embodied. I was in a body. The body hurt, and the hurt meant I was alive. Then light. Then the voices of people I recognized. My surgeon, a nurse whose name I would later learn, someone saying my name. Then the weight. The specific weight of a body that had been unconscious, the heaviness of being embodied, the realization that I had been somewhere that had no weight, and now I had weight again. Then the cold. The particular cold of a hospital, the lack of the warmth I had felt in my grandmother's kitchen. Then the specific discomfort of a hospital bed, which I had described to patients for 18 years without having adequately understood what I was saying. The discomfort was not terrible. The discomfort was a confirmation that I was alive. I have been back at work for 2 years. I still have the right tone. I still have the right sadness. But the tone and the sadness are not performed anymore. They are real. But I am no longer behind the glass. I have dismantled the barrier. When a patient looks at me in that room and asks me what is coming, I tell them the truth, which includes what I saw at my grandmother's kitchen table. I tell them about the warmth. I tell them about being known. I tell them that the terminal confusion they have been reading about in the medical literature is not confusion. It is clarity. It is the moment when the glass wall comes down. Some of them laugh. Some of them cry. Some of them sit in silence for a long time, digesting what I have told them. All of them, I think, know it is real. All of them understand that I am not performing anything. I am just telling them what I know. I am not offering them hope. I am offering them knowledge. And more than that, I am no longer alone with the weight of it. I no longer carry the accumulated deaths behind a barrier of professional distance. I pick them up and I feel them in my own body. I feel their fear and their confusion and their pain, and I set it down with them. I understand that when I do that, I am bearing witness to something sacred. I am sitting at a kitchen table with someone who is about to understand something I have already understood. I am preparing a space for them to know that they are known, completely. I am preparing them for warmth. And the knowing does not end. The kitchen table is real. The warmth is real. The presence of the people who made those kitchens what they were is real. They are at those tables, exactly themselves, waiting with all the patience that they always had. Not waiting for you to earn your place. Not waiting for you to understand. Not waiting for you to become someone worthy of their presence. Just waiting. Waiting because they love you. Waiting because love does not end. Waiting because you have always belonged there, exactly as you are. They are waiting for you to understand that the warmth you have been looking for your whole life, the warmth you tried to find in professional distance and medication, and the careful holding of space for other people's dying, is the warmth that holds everything. It is not separate from the world. It is not something you have to earn. It is what is real. It is what lasts. It is what remains when everything else falls away. I spent years offering people a professional version of peace that I had never actually found for myself. I stood behind glass and offered comfort while keeping the comfort at a distance. I told people that dying could be peaceful while not believing it. I told myself that this was wisdom. I told myself that by not feeling the weight of their deaths, I was somehow honoring them. I was wrong. I put together a short guide about what I witnessed in 18 years of palliative care and what 9 minutes in a surgical ICU confirmed about what is real on the other side of the last breath. The link is right below this video. Because the table is set, the tea is ready, and the people who loved you are already there. They have always been there, and they are waiting for you to come home.